Welcome to NSG 223 Study Session 3, Regulations and Organizations of Midwifery Practice. Introduction. In the last study session, you learned about development of family-centered maternity care. The Nursing and Midwifery Council of Nigeria is a Category B parastatal of the Federal Ministry of Health established by Decree number 89, 1979, now known as Nursing and Midwifery Act, Cap 143, Laws of the Federation of Nigeria, 2004. It is the only legal, administrative, corporate, and statutory body charged with the performance of specific functions on behalf of the Federal Government of Nigeria in order to ensure the delivery of safe and effective nursing and midwifery care to the public through quality education and best practices. The Council is mandated by law to regulate the standards of nursing and midwifery education and practice in Nigeria and to review such standards from time to time to meet the changing health needs of the society. In this study session, you will be introduced to the origin, establishment, functions of the Nursing and Midwifery Council of Nigeria, and the roles of various national and international organizations involved in healthcare services. Learning outcomes. When you have studied this session, you should be able to 1. Discuss the origin, establishment, and functions of the Nursing and Midwifery Council of Nigeria. 2. Describe the roles of various national and international organizations involved in healthcare services. Nursing and Midwifery Council of Nigeria. The Nursing and Midwifery Council of Nigeria is a Category B parastatal of the Federal Ministry of Health on 28th day of September 1979. The federal military government established by Decree number 89, 1979, a body to be known as the Nursing and Midwifery Council of Nigeria of the Nursing. Hereafter, in this decree, referred to as the Council, and Midwifery, which shall be a body corporate with perpetual succession and a common seal, and may sue and be sued by name aforesaid. It is now known as Nursing and Midwifery Registration etc. Act Cap 143, Laws of the Federation of Nigeria, 2004. The Council is a body corporate with perpetual succession and a common seal. The primary objectives of the Nursing and Midwifery Council of Nigeria are to ensure high quality of nursing and midwifery education in Nigeria, maintain high standard of professional nursing and midwifery practice, and ensure discipline within the profession. The Council has its headquarters in Abuja with zonal offices in Sokoto, Kaduna, Bauchi, Enugu, Port Harcourt, and Lagos. Origin. Nursing as a profession came into existence as early as human existence. It is the foremost caring profession. It rested, survived, and consolidated its position through the ages by developing its own language, rituals, arts, and sciences from the physical, psychosocial, and spiritual needs of the patients. The history of nursing education and practice in Nigeria is closely interwoven with the history of nursing as a universal profession, the history of education, and the history of Nigeria itself. Modern scientific nursing started with the crusading efforts of Miss Florence Nightingale, 1820 to 1910, during and after the Crimean War, 1854 to 1856. She combined Christian ideals, strict discipline, and a sense of mission to open the door for what is known today as the nursing profession. Nursing was the first profession in the health industry to form an international organization. The International Council of Nurses formed in 1899. In 1916, the Royal College of Nursing was founded, while in 1919, the General Nursing Council for the England and Wales came into existence. The early missionaries who arrived in Nigeria in the early 19th century had the strong belief that Jesus Christ is the spiritual king, the greatest nurse and physician capable of caring for and healing whatever affects the body, mind, and the soul. They combined their missionary work with the provision of medical and nursing care to the sick. With the amalgamation of the colony and the protectorate of Nigeria into one country in 1914, Nigeria became a colony of Britain. Nursing, like all other professions, developed and witnessed rapid changes to meet the changing needs of the society it serves. The First and Second World Wars also had impact on the growth and development of the nursing profession. Establishment. The Nursing and Midwifery Council of Nigeria is a Category B parastatal of the Federal Ministry of Health on 28th day of September 1979. The federal military government established by Decree No. 89, 1979, a body to be known as the Nursing and Midwifery Council of Nigeria of the Nursing. Hereafter, in this decree, referred to as the Council and Midwifery, the Council is headed by a Secretary, General Registrar, and is assisted by other professionals and non-professional staff. They are responsible to a board headed by a chairman with members drawn from various institutions and zones in the country. In order to assist the federal government in achieving its healthcare reform agenda, the Council has close working relationship with other sister organizations under the Federal Ministry of Health. These include Pharmacists Council of Nigeria and other health parastatals. The aim of creating this report is to work as a team in assisting the government in actualizing its objectives in the healthcare sector. The Council also works in partnership and collaboration with national and international non-governmental organizations such as WHO, UNICEF, USAID, the British Council, International Council of Nurses, International Council for Midwives, Institute of Human Virology, Nigeria, IHVN, International Center for AIDS Care and Treatment Programs, ICAP, West African Health Organization, WAHO, IPAS, Netherlands Leprosy Relief Organization, JSI, MMIS, Nigeria, Family Health International, GHAIN, PATHS, NACA, Pathfinder International, Society for Family Health, etc., in developing and implementing various health programs, projects, workshops or seminars, etc., aimed at uplifting the standards of nursing and midwifery education and practice in the country. Functions of the Nursing and Midwifery Council of Nigeria. The primary objectives of the Nursing and Midwifery Council of Nigeria are to ensure high quality of nursing and midwifery education in Nigeria, maintain high standard of professional nursing and midwifery practice, and enforce discipline within the profession. Broadly, The Council's functions are related to those of designing, implementing, and evaluating various nursing and midwifery educational programs of indexing, examination, registration, certification, licensure of professional nurses and midwives, and monitoring standards of nursing and midwifery practice in the country. Specifically, the Council's functions are as follows. 1. Index all categories of nursing and midwifery students on commencement of their training. 2. Develop and review periodically the different curricula utilized for the education of all categories of nurses and midwives. 3. Cooperate with recognized bodies interested in conducting new schemes for basic and post-basic education of nurses and midwives, such as National Universities Commission, World Health Organization, etc. 4. Accredit all training institutions and clinical practice areas utilized for the education of all categories of nurses and midwives in Nigeria. 5. Conduct professional examinations for all categories of nurses and midwives in Nigeria. 6. Establish and maintain registers of all persons qualified to practice the discipline of nursing and midwifery in Nigeria. 7. Conduct registration interviews for nurses and midwives trained outside Nigeria who are seeking to practice in Nigeria. 8. Issue and update professional practicing licenses every 3 years to all cadres of qualified nurses and midwives. 9. Issue professional certificates to all cadres of nurses and midwives at the end of their training. 10. Revoke and/or restore professional certificates as applicable. Council structure. The Nursing and Midwifery Council of Nigeria has a governing council board. The board of the council is made up of 19 members, appointed by the federal government on the recommendations of the Federal Ministry of Health. The board formulates policies that brings improvement to nursing education and nursing practice in Nigeria. The new status of the council has given rise to the creation of 4 major departments, namely Education, Inspectorate, Planning, Research and Statistics, Human Resources, Finances and Accounts. Board members. 1. The chairman, who is appointed by the Honorable Minister of Health. 2. The head of nursing services at the Federal Ministry of Health. 3. 4 nurses, each of whom shall be a head of nursing services in the State Ministry of Health from the 4 health zones on rotation among the states within each zone. 4. 4 nurses, each of whom shall be an educator in nursing, midwifery, public health nursing and psychiatric nursing, who will serve on rotation from the 4 health zones. 5. 2 nurses to represent the National Association of Nigerian Nurses and Midwives. 6. 2 people to represent public interest. 7. 2 nurses to represent universities offering degree programs in nursing. 8. 1 registered medical practitioner who shall be an obstetrician and gynecologist. 9. The secretary to the board, who is the Secretary General Registrar of the Council. The Council conducts its affairs through standing committees, which under the auspice of the Secretary General meets to deliberate on vital professional, educational, and administrative matters and make necessary recommendations to the board. Midwives' legal coverage. Ignorance is no defense in law. It is unacceptable under the law to do anything that is illegal and use ignorance as an excuse. Thus, a registered midwife must be licensed to practice. A lecture on the midwife and the law is not supposed to make midwives and nurses lawyers, but to make them aware of the legal aspects of questions that may arise at any time, particularly during the course of their career as midwives or nurses. Is there absolute justice in Nigeria? Access to justice is a much vented value, boastful talk in most legal systems of the world, including Nigeria. But only a few really have this access. What justice is there in a system where the majority of the populace is ill-informed about its rights and obligations under law, or where those who even have a smattering idea of their legal rights cannot afford the means of its enforcement? It is the desire to increase awareness about legal rights and obligations of the midwives that necessitated the inclusion of this lecture on the midwifery curriculum in Nigeria. Midwifery or nursing has the backing of the law. For example, there is Nursing and Midwifery Registration, Decree number 89 of 1979 Law of the Federal Republic of Nigeria. It is under the laws of the Federal Republic of Nigeria to regulate the conduct of nurses and midwives. The first relevant legislation to be examined is the Nursing and Midwifery Registered etc. Decree number 89 of 1979, which is an important law in nursing activities in Nigeria, as it brings under one general umbrella the registration of nurses and midwives. Under Section 1 of this decree is established a body to be known as the Nursing Council of Nigeria. Functions conferred upon this body are clearly stated in the Nursing and Midwifery Decree as follows: to determine who are nurses and midwives, to determine what standards of knowledge and skills are to be attained by persons seeking to become members of profession of nursing and midwifery. Roles of national and international organization in midwifery practice. Midwifery, like nursing, is a profession that is guided by rules and regulations of the profession regulations. According to International Confederation of Midwives, a professional regulation could simply be described as the means by which order, consistency, and control are brought to a profession and its practice. In Nigeria, the Nursing and Midwifery Council of Nigeria regulates midwifery practice, while UKCC is the regulating body for United Kingdom. However, the International Confederation of Midwives, ICM, is one of the foremost actors in the global arena working to improve maternity services through the empowering of midwives and promotion of good practice. Apart from the already mentioned profession bodies, other national and international organizations which play important roles in the practice of midwifery are: 1. Nursing and Midwifery Council of Nigeria. 2. World Health Organization, WHO. 3. The United Nations Children Emergency Fund, now renamed United Nations Children Fund, UNICEF. 4. West African College of Nursing. 5. United Nations Economic Development Programme, UNEP. 6. United Nations Development Programme, UNDP. 7. United Nations of American International Development Agency, USAID. 3.2.1 International Confederation of Midwives, ICM. The International Confederation of Midwives, ICM, is a non-governmental organization which came into being in 1919 as the International Midwives Union. According to Bennett and Brown, 1999, the purpose was to improve the services available to childbearing women through campaigning for a stronger, better educated, and properly regulated midwifery profession. ICM 1994 PI. The United Nations accredited ICM in 1960. Roles of ICM. 1. Improvement of the services available to childbearing women through campaign for a stronger, better educated, and coordinating of the International Day of the Midwife annually. 2. Assisting midwives and midwifery association to unite under a central banner to promote the role and responsibilities of the midwife under a specific theme. 3. Bringing together a group of midwives from different countries for workshops, seminars, and triennial congress. The triennial congress is valuable because it has been a useful vehicle for promoting midwives and midwifery in the host country. The United Kingdom Central Council for Nursing Midwifery and Health Visiting, UKCC. The UKCC, now NMC, is the regulatory body for nursing, midwifery, and health visiting in the United Kingdom. The statutory control of the practice, education, and supervision of midwives became the responsibility of the UKCC, National Boards of Nursing, Midwifery, and Health Visiting Boards on 1st July 1983, Bennett and Brown, 1999. Roles of UCKK, now NMC. 1. To maintain register for qualified nurses, midwives, and health visitors. 2. To set standards for nursing, midwifery, and health visiting education practice and conduct. 3. To provide advice for nurses, midwives, and health visitors on professional standards. 4. To consider allegations of misconduct or unfitness to practice due to ill health. Roles. 1. Index all categories of nursing and midwifery students on commencement of their training. 2. Develop and review periodically the different curricula utilized for the education of all categories of nurses and midwives. 3. Cooperate with recognized bodies interested in conducting new schemes for basic and post-basic education of nurses and midwives, such as National Universities Commission, World Health Organization, etc. 4. Accredit all training institutions and clinical practice areas utilized for the education of all categories of nurses and midwives in Nigeria. 5. Conduct professional examinations for all categories of nurses and midwives in Nigeria. The World Health Organization, WHO. The World Health Organization was founded in 1947 and it now has 154 member states. Its headquarters are located in Geneva, Switzerland, and it has 6 regional offices, Lucas and Gales, 1998. These regional offices and their locations are as follows. 1. African Regional Offices, AFRO, Brazzaville, Congo. 2. Regional Office for the Americas, AMRO, Washington, D.C., USA. 3. European Regional Office, EURO, Copenhagen, Denmark. 4. Southeast Asia Regional Office, SEARO, New Delhi, India. 5. West Pacific Regional Office, WPRO, Manila, Philippines. The UNICEF. The United Nations Children Emergency Fund, now renamed United Nations Children Fund, is an international organization financed almost entirely by voluntary contributions from governments, private foundations, and public donations. It is particularly concerned with the well-being of children in developing societies. Its roles: 1. Assisting countries to establish accelerated programs of immunization. 2. Sponsoring of workshops and seminars on children's welfare. 3. Promotion of awareness through jingles, through the electronic media and posters. 4. Promotion of children's well-being through growth monitoring, oral rehydration, breastfeeding, immunization, and family planning. 5. Sponsoring of female literacy programs and supplementary feeding. The West African College of Nursing, WACN. This body was inaugurated in April 1981 in Banjul, Gambia, as one of the special agencies of the West African Health Community, WAHC. They assist in pursuance of the goal of nursing and midwifery education at the basic and post-basic level. They maintain standards of practice of nurses and midwives within the community. Roles: 1. Sponsoring of in-service educational programs. 2. Assisting in providing facilities for nursing and midwifery education. 3. Encourage and promote research in the field of nursing and midwifery. 4. Production of textbooks and journal on current issues in nursing and midwifery practice. 5. Disbursement of research funds to member states. 6. Assisting in the formation of nursing and midwifery education program and to support the management and funding of such program in accredited institutions in the member states. Summary. In this study session, you have learned that 1. The Nursing and Midwifery Council of Nigeria is a Category B parastatal of the Federal Ministry of Health on 28th day of September 1979. The federal military government established by Decree No. 89, 1979, a body to be known as the Nursing and Midwifery Council of Nigeria of the Nursing. 2. Nursing as a profession came into existence as early as human existence. It is the foremost caring profession. 3. The primary objectives of the Nursing and Midwifery Council of Nigeria are to ensure high quality of nursing and midwifery education in Nigeria, maintain high standard of professional nursing and midwifery practice, and enforce discipline within the profession. 4. Midwifery, like nursing, is a profession that is guided by rules and regulations of the profession regulations. According to International Confederation of Midwives, 1996, a professional regulation could simply be described as the means by which order, consistency, and control are brought to a profession and its practice. End of study session 3. Thanks for listening.